Hello everyone. Today, we're exploring a medication called Jinteli, which is a combination of estrogen and progestin. As always, our discussion is meant for educational purposes. If you have health-related questions or concerns, always reach out to a medical professional. Description: Jinteli, a combination medication, includes two active ingredients, ethinyl estradiol and norethindrone acetate. This oral tablet falls under the category of hormone replacement therapy, HRT, and is primarily prescribed for the management of menopausal symptoms. Menopausal symptoms can include hot flashes, night sweats, and vaginal dryness, which are caused by the decrease in estrogen levels during menopause. Jinteli helps alleviate these symptoms by supplementing the body with estrogen and progestin. Additionally, it is used to prevent osteoporosis in postmenopausal women who are at significant risk of osteoporosis and who cannot use non-estrogen medications. Warnings: Jinteli comes with specific warnings. It should not be used by women who have had a hysterectomy, as the progestin component is not necessary for these individuals. Women with a history of hormone-sensitive cancers, such as breast or uterine cancer, should avoid this medication due to the potential for increased risk of these cancers. Jinteli is also not recommended for individuals with liver disease, a history of blood clots, stroke, or certain cardiovascular conditions. Smokers, particularly those over 35, should avoid using Jinteli due to an increased risk of serious cardiovascular events. Before taking this medicine. Before starting Jinteli, it's crucial to discuss your medical history with your healthcare provider. Inform them if you have any allergies, particularly to estrogen or progestin. Women with a history of cardiovascular diseases, liver problems, gallbladder disease, kidney issues, or blood clotting disorders need to consider the potential risks and benefits carefully. It's also important to inform your doctor if you have a family history of breast cancer or if you have diabetes, high blood pressure, high cholesterol, or obesity. If you are pregnant, planning to become pregnant, or breastfeeding, Jinteli is not recommended. Regular checkups and screenings, such as mammograms and pelvic exams, are advised while on this medication to monitor for any adverse effects. It's also important to discuss any upcoming surgeries or prolonged periods of immobility with your doctor, as Jinteli may need to be discontinued temporarily to reduce the risk of blood clots. Side effects: all medications can have side effects, and Jinteli is no exception. Common side effects include nausea, vomiting, bloating, breast tenderness, headache, or weight changes. Some individuals may experience mood changes, such as depression or anxiety, and it's essential to report these symptoms to your healthcare provider. Serious side effects can include blood clots, stroke, heart attack, liver problems, and increased risk of breast or uterine cancer. Symptoms such as unusual vaginal bleeding, chest pain, shortness of breath, severe headache, vision changes, or swelling in the legs should prompt immediate medical attention. Additionally, Jinteli may cause an increase in blood pressure, so regular monitoring is recommended. Interactions: Jinteli may interact with other medications, potentially altering their effectiveness or increasing the risk of side effects. It's important to inform your healthcare provider about all medications, supplements, and herbal products you are currently taking. This includes prescription and over-the-counter drugs, as well as any dietary supplements. Dosage: correct dosage is vital for the effectiveness of any medication. Always adhere to your doctor's recommendations when taking Jinteli. Typically, the dosage involves taking one tablet daily, preferably at the same time each day to maintain consistent hormone levels in the body. Do not alter your dosage without consulting your healthcare provider, and if you miss a dose, take it as soon as you remember unless it is almost time for the next dose. In that case, skip the missed dose and resume your regular schedule. Avoid. While on Jinteli, it's advisable to avoid smoking due to the increased risk of cardiovascular events. Alcohol consumption should be limited, as it can exacerbate certain side effects and increase the risk of liver problems. Maintaining a healthy lifestyle, including a balanced diet and regular exercise, can help mitigate some of the risks associated with hormone replacement therapy. FAQ: many wonder about the duration of use for Jinteli. Typically, hormone replacement therapy is used for the shortest duration necessary to manage menopausal symptoms. It's important to have regular consultations with your healthcare provider to assess the need for continued therapy. Jinteli is generally not recommended for long-term use beyond managing menopausal symptoms and preventing osteoporosis in those at significant risk. Closing. That wraps up our overview of Jinteli. Remember, this information aims to educate and should not replace professional medical advice. Always consult with a healthcare provider for any questions or concerns. Thank you for tuning in.